Walking is something we do every single day, right? But most of us probably never give a second thought to how we do it. It just happens. But what if I told you that that simple automatic process can tell a really complex story about your health? Well, today we're going to decode that story and figure out what your walk might be trying to tell you.
Seriously, just think about it for a second. Is your stride smooth and even? Is your balance rock steady? A change in the way you walk isn't just a sign of getting older. It could be one of the very first clues your body sends out that something, somewhere, needs a little bit of attention.
So what are we actually talking about here? Well, a gait abnormality sounds a bit clinical, but all it really means is any change from a normal walk. It's not a disease in itself. Think of it more like a signal, a symptom. It's your body's way of saying, hey, one of the many complex systems we need for walking, like strength or balance or coordination, might be a little out of sync. It's like the first clue in a medical mystery.
Okay, so our first clue, it's all about the body's mechanics. I want you to think of your body as this incredible, high-performance machine. Now, if any part of the frame, we're talking your bones, your joints, your muscles, isn't working just right, the whole machine's movement is going to be affected.
And this is usually the most obvious place to look, right? If a joint is stiff because of arthritis or maybe a muscle is weak, your body is smart, it's going to compensate. This can lead to what's called an antalgic gait, which is just a fancy way of saying you change how you walk to stay away from pain. Even things from way back, like old fractures or a new joint replacement, can permanently change your body's mechanics, tweaking your personal walking signature for good.
Of course, a machine is only as good as its operator. And that brings us to our second clue, the command center. Our brain and our nervous system are in a constant state of communication, sending and receiving a flood of messages just to make walking happen smoothly.
Walking feels so simple, but behind the scenes, it's an absolute neurological masterpiece. With every single step you take, your brain has to coordinate dozens of muscles, process all the sensory information coming from your feet, and constantly fine-tune your balance. So you can imagine if there's even a tiny glitch in that command and control system, it's going to show up in your walk.
And what's really fascinating here is how incredibly specific these changes can be. For instance, a shuffling walk might point a doctor towards Parkinson's. A scissor gait is something often seen in conditions like cerebral palsy. Or a steppage gait, that's where someone has to lift their knee really high so they don't trip, that points to something called foot drop. These distinct patterns aren't just quirks, they are huge diagnostic clues for doctors.
And the potential culprits messing with this command center, well, they're all over the map. They can be conditions that affect the brain directly, like MS or Parkinson's, or they could be issues with the wiring itself, the nerves in your legs and feet. That's a condition known as peripheral neuropathy. Each one of these can disrupt those critical signals we need for a smooth, stable walk.
But here's the thing. The cause isn't always a problem with the body's internal hardware or software. Our third clue shows that sometimes the problem is something we introduce from the outside.
This is a big one. And it's one that you might not even think about. We take medications to solve problems, but every now and then they can create new ones, including affecting our balance and how we walk.
Yeah, a lot of common medications can have side effects that just throw you off balance. Antidepressants or sedatives might cause drowsiness, some blood pressure meds can make you feel dizzy when you stand up, and anticonvulsants can directly cause something called ataxia, which is basically a disturbance in your gait. So it's absolutely crucial to talk to your doctor about this.
And, this external factor isn't always about what you're taking. Sometimes the issue is what you're not getting enough of, like a critical nutrient.
Let's look at a real-world example. This quote comes from a medical case report. It's about a man whose only major symptom was that he had an unsteady walk. And the culprit? Well, it was a total surprise to everyone.
I mean, this case is just a perfect example of how a simple deficiency can look like a really complex neurological disease. This poor guy developed some serious symptoms, but the fix was surprisingly simple. After getting some vitamin B12 injections, his unsteady walk, the numbness, all of his symptoms completely disappeared. Amazing, right?
And just to put this into perspective for you, a normal, healthy vitamin B12 level is over 300. His was all the way down at 100. I mean, that's a huge drop, and it shows you just how serious this kind of deficiency can be and how deeply you can affect the nervous system, leading straight to an abnormal gait.
Okay, for our last clue, we're diving into the most complex connection of all, the one between our mind and our body. And honestly, this might be the most surprising cause of a walking problem.
This is truly fascinating. What this is basically saying is that our mental state, our psychological distress, can literally show up as a physical problem with walking. It's not all in your head in that dismissive way people sometimes say it. No, the brain is genuinely creating a physical symptom.
So conditions like severe anxiety or depression can actually impact how you walk. And there's this one really specific and powerful factor, especially in older adults: the fear of falling. This fear can become so intense that it creates a self-fulfilling prophecy, causing a person to adopt this overly cautious, unstable walk that, ironically, actually increases their risk of falling.
Okay, so we've been detectives here. We've looked at all the clues, from the body's mechanics and the brain's commands to outside factors and even the mind itself. The big question is, what do you do with all this information?
If there's one thing you take away from all this, let it be this: a limp, a shuffle, a feeling of unsteadiness. It isn't something to just ignore or brush off as nothing. It's your body trying to send you a message.
So let's just recap the big ideas here. First, your walk is a vital sign of your overall health. Second, the causes can come from anywhere, from your bones to your brain, from the pills you take to your psychology. But most importantly, so many of these causes, like that vitamin B12 deficiency, are treatable once you figure out what's going on. The real key is to listen to your body and talk to a doctor.
Every single step you take is another sentence in the story of your health. So maybe just take a moment to listen. Pay attention to its rhythm, its balance, because understanding that story, well, that's the first step toward maybe changing the ending. Thanks for joining me.